The Anglevator utilizes the advantages of an angle blade versus a straight blade. An angle blade increases cutting efficiency, increases penetration power, and enhances the engagement with the root surface. The Anglevator was designed to go deep into the PDL space, sever the PDL, and still be able to elevate the tooth like an elevator. It can also cut gingiva, lift the periosteum, and even chisel bone. There is no other instrument designed to do this. The Anglevators come in a set of three. There are two 3mm Anglevators, a right and a left angle. These are the workhorses of your kit and will do 80 to 90% of your extractions. There is also a larger 5mm Anglevator. This is great when you need to get into large bony defects or if you need more torque. The Anglevator's large plastic handle was inspired by an award-winning Scandinavian design. It allows you to have fingertip control while you probe the PDL space looking for an advantage, and gives you the ability to provide a tremendous amount of torque when needed, just like an elevator. The kit's forceps are designed with thin serrated beaks that allow you to go deep into the PDL space and give a secure grip on the root surface. Here are the forceps of the kit. This is a 150, great universal forceps, capable of pulling any tooth in the mouth, upper or lower. If you're ever stuck with one forceps only, this would be it. Its versatility is unsurpassed. It provides tremendous control and great comfort. And its companion, the Mini 150, great for root tips, section teeth, hard to reach spaces, upper or lower, great universal forceps. I use it actually on a lot of wisdom teeth. And also we have the bird beak. It provides a tremendous amount of torque from premolar to premolar, upper or lower. This design allows you a tremendous amount of torque when needed. I use this forceps on thousands of premolars sent to me by Ortho. And its companion, the Mini bird beak, great for root tips, anterior, lower, hard to reach spaces. And don't let the minis fool you. They give you a tremendous amount of torque when needed. It's a great little forceps. And also the cow horn, or the 23. This forceps is designed to get into the furcation, squeeze, and pop up and out. And the 222, this is great for third molars or any situation where your patient has a limited range of opening when you got to get into the posterior. Very strong forceps. All the forceps are made in America of German stainless steel. Now we will see the Anglevator in action on a broken root tips number 30 and number 20. These are relatively easy, simple extractions, and when you're watching the video, you will see me over-exaggerating the movements, taking a little longer on the extraction, just so you can see how the Anglevator works in the PDL. See, so here we are, taking the Anglevator to 3mm, working into the mesial, feeling around for a solid tooth and bone, working now in the distal. You can see how it navigates into the PDL. The teeth are already starting to get loose. Normally this extraction, you would take these out probably within 30 seconds. So I'm going to show you going into the mesial, feeling for hard root surface. You're engaged, lifting up and out. The tooth is already getting loose. And push a little from the buccal. The angle's engaged into the mesial root surface. And just lift it up and out. And the assistant can take that with the suction. Now you have the distal root. And again, I'm over-exaggerating movements. You're going to work this around the distal and the buccal. And just, there the root's already moving a little bit. And you're going to continue to work with, see the over-exaggerated movements, like a little push and nudge technique. And that root is loose. The opposing finger is there to support and protect and help give you tactile feel. And there you see the root is loose. And again, just going back to show you how you can penetrate into the PDL and luxate the roots. So here you're going to take a mini 150, a little pinch, a little decay on the lingual, then you just grab the root and up and out. Now you can do whatever you want with that socket. Right now we're going to go over and do the same thing on number 20. Here you see the root is buried, it's decayed. You can take the blade and just clean away some decay. And what you want to tell your assistant is to keep your field of vision so you can see the root and the bone interface. That's what we're looking for. Here you're going under the gingiva, feeling around for that bone root interface, the PDL space, and when you find a spot, you're going to exploit it. You're going to penetrate around until you find it. Here you're going right under the gingiva, feeling for that PDL space, the opposing hand supporting. And again, we're going to just take our time to try to show you how effective the Anglevator is. And we're going to go in from the lingual or the distal here, feeling for the PDL space. And from the lingual, again, feeling for solid root and bone. And when you feel it, then you push and nudge, just like that. You see the tooth is already loose a little bit. You're going to go under the decay to feel for solid root. Work into the PDL space, and there the tooth is already out of the socket. And just exaggerating the movements, how you can go down deep. Sometimes you go all the way to the apex and the tooth just pops right out. I'm going to go around the buccal, see how it can release the gingiva. Tooth is loose, didn't need a blade, didn't need a flap. Again, I'm going to go around one more time and just show you how effective the Anglevator is at releasing the gingiva. There. Again, the tooth is ready to be extracted. Again, the mini 150 is great on these root tips, and it's out. Just a little bit of residual root there stuck to the gingiva. You're going to pop that out. And there you have pretty simple extractions of root tips.